The Alliance for Sustainable Health and Wealth in Africa, ASHWA, is a registered community-based organization that supports vulnerable communities by improving on their health and access to water, sanitation and hygiene, livelihoods and resilience, and humanitarian emergency affairs. Following the outbreak of COVID-19 pandemic, many people all over the country are experiencing hardship and a total loss of income. The key populations, for example, sex workers, street children, non-injectable drug users are just among those that have been hit the most. Our ASHWA volunteers continue to provide the much-needed awareness on the coronavirus within Busia municipality and Dabani sub-county. The volunteers have been supported with protective gears and as well facilitated to inform the community about the prevention measures of the coronavirus and demonstrate to community members simple measures that will help prevent the virus, like maintain social distance and hand washing, among others. Through distributing posters around markets and trading centers, erecting banners and hand washing facilities, moving door to door, we've reached over 5,000 community members with accurate information on the spread and the vital prevention methods that can reduce the spread of coronavirus. With support from the Busia District Local Government and AIDS Health Foundation, we have been able to reach out and support some of the most vulnerable persons identified from targeted key areas in Busia District with food and medical supplies.
Officials of ASHWA, Alliance for Sustainable Health and Wealth in Africa, I would like to take this opportunity on behalf of also the President and on behalf of the Busia District Task Force for the COVID-19 pandemic. From the bottom of our hearts, we thank you. We appreciate you for this large act.
COVID did not attack a specific people, but as it has affected more the most vulnerable of society. And who are these? These are the street children, these are the girls who are working in the bars, these are the women who call themselves self-employed, the HIV infected persons, and the street children. So we look at the widows,
and I would like to pray that may the Almighty God continue to bless you with these resources so that you keep coming back to fill up the gaps where we not being able to respond.
In these delicate times, the greatest threat to the safety of street children against coronavirus infection is their way of living. Street children have no access at all to clean water, soap and sanitizers to wash their hands in their hideouts. They are usually too crowded in areas where they sleep, which makes it impossible to socially distance.
What we have done is to register them, help them to come home, but of course we don't have enough support for all of them. Tomorrow they might be back on the streets, but we are saying we don't want to see that. We want to work together with other partners who are willing to join this initiative to continue having these students stay at home.
Life in the lockdown is not easy because they have nowhere to go. Besides, they are afraid of starving. Many of them have no means of communication, no identification, no means of transport. And this means that during the lockdown and after, they cannot go back home because they fear being mistreated, and neither can they access basic healthcare services available. Sex workers all over the country are experiencing hardship, a total loss of income, and increased discrimination and harassment by the general community and the uniformed personnel during curfew hours of the night. Sex workers are often the breadwinners in their families. Others are the primary caregivers for their aged parents or single parents who want their children to have better opportunities. Additionally, they are targets of abuse and exploitation.
Abasinga tulina abaana ffe bamaama ffe bataata naye embeera eno kuba yagwawo abaana baffe tetumanyi embeera gye bayitamu twabaleka mu maka ng'obeerawo n'ojja n'okula n'ofunayo akasente n'ogenda n'obalaba n'okomawo. Naye twabeera wano ne batukwata ku tteeka lya Pulezidenti Museveni ne batutulugunya eyo ku CPS. Ne tubeerayo ebbanga nnaku zaali 3 ne tukomawo naye n'okufuna ekyokulya kizibu.
As sex workers and their clients continue to self-isolate, they are left unprotected, increasingly vulnerable and unable to provide for themselves and their families. Therefore, excluding them from the COVID-19 social protection responses leaves them with no option but to put their safety, their health, and their lives at risk just to survive. Young people living with HIV urgently need to be supported to access essential services offered, accurate information on COVID-19, access monthly refills of chronic medication, and other innovative tools implemented more broadly, including HIV self-testing. The COVID-19 pandemic, as with other health crises, has exposed existing inequalities and affects people already criminalized, marginalized, and living in financial precarious situations, often outside social protection mechanisms. During these times, we have drawn our attention to the particular hardships and concerns facing people living with HIV/AIDS. Many of us are responding to the COVID-19 pandemic by practicing social distancing and self-isolation. However, the elderly and the widows live in social contexts that simply cannot follow this strategy. Forced closures of markets, limited access to clean water and sanitation, and the spread of misinformation is completely disrupting the efforts to curb the spread of COVID-19 in the communities of Busia, leaving many at high risk. With the uncertainty of when life may return to normal, many widows as well as elderly persons are in dire need of food, medical support, psychosocial support to combat the stress and anxiety they are currently experiencing following the outbreak of the COVID-19 pandemic. Stay home, stay safe until this is over.